Hi, my name is Dr. Steve Miners of Rehab Effects in Austin, Texas. And today we will be discussing applied kinesiology and its application. We have a patient here that we're going to use to help us today. And in applied kinesiology, since muscle testing is the primary feedback mechanism to diagnose, that's what we'll be doing here and using her arm. So, Sarah, please hold it. Don't let me pull. Excellent. So what we will do now is perform a body scan to determine the area that needs to be addressed and how it needs to be addressed. Okay, hold it please. Great. And hold it again. Good. Now, we're going to go ahead and check the bladder. Put your hand right there. When we put the hand there, that is a form of what's called therapy localization. And in applied kinesiology lingo, we refer to that as TL, therapy localization. And contacting that area is essentially asking the nervous system, is this an area that we have a problem with? Is this an area that requires our attention? Hold it please, Sarah. Yes, it is. Now, what we need to know at this point is, as I mentioned in a previous segment, is it structurally related? Is there a chemical relationship? Is there an emotional relationship? Is there a visceral relationship or myofascial relationship? So that's what we'll do now. So we want to know, is there a structural relationship? No. Strong muscle indicates that there is no structural relationship. So in that case, a spinal manipulation may not be indicated in this case. Is there a chemical relationship? No. So there's no potential heavy metal burden that is causing this. Is there a visceral relationship? Okay. Visceral relationship, muscle was weak, tested weak. As a result of the visceral relationship testing weak, we need to determine exactly where. Is it just the bladder itself? Is it the gastrointestinal system, liver, kidneys, and other related areas? So, bladder, yes. We're going to test the other areas as well, just to make sure there isn't a co-relationship. Liver, kidneys, small intestine, ileocecal valve, large intestine, stomach, bladder. Therefore, we know that the only area that needs to be addressed is the bladder. So that is our form of diagnosis, and as far as the therapy is concerned at this point, now what we would do is we would actually go about adjusting the gallbladder, and that would really be performing soft tissue manipulation to the area, which would be in this fashion. Bend your knees, please. Okay. And you would place your hand at the very bottom of the gallbladder, and you would bring the knees up, and the hand that's in there is really doing this. So you're adjusting the gallbladder up. You only do this to the patient's tolerance, of course. Great, thank you. Okay. Now, since this is a primary feedback mechanism, we're going to go ahead and recheck that to make sure what we set out to do was done, and if it wasn't, why. And why it wasn't could possibly be because we need to do more of it or address something else. Go ahead and straighten your legs out, please. Okay, so we therapy localize the same area and we check again. Great, much stronger. The benefit here is that athletes and everyday people alike may present with low back pain that may be related to a bladder issue similar to this one. And we can reduce the pain a lot faster and help quicken recovery.